Good morning. My name is Diana Zamora. I am the public health nurse here at SCIHP, as well as the project coordinator for the Acorns grant.
Hello, my name is Tanya Cordova. I am the CHR CMA here at SCIHP, and I am the project lead on the Acorns grant.
In the next slide, we are going to be discussing where the funding from Acorns comes from. CDC operates Good Health and Wellness in Indian Country, GWIC. It is the largest grant created to improve American Indian and Alaska Native tribal health. The main focus is on health promotion and chronic disease prevention. CRIB, the California Rural Indian Health Project, applied and were awarded this 5-year grant. In turn, SCIHP applied to CRIB and we were awarded funds to implement projects that reduce rates of chronic disease from commercial tobacco use, diabetes, heart disease, and stroke, using a holistic approach. In 2022, the SCIHP Acorns team is focused on reducing commercial tobacco use and prevention of heart disease and stroke. This is being performed mainly by collaborating with the medical team, creating and promoting health education, creating physical activity programs, as well as organizing community outreach events. We'd like to describe the Acorns projects, and the best way is to ask, what does the upstream model look like in healthcare, and how does the Acorns grant help in creating it? By improving factors such as health education, social connection, and food access, we can attempt to change health outcomes. Let's take a look at a following short video that gives us an example of an upstream model, and afterwards we will discuss how Acorns is using this model to make an impact with the SCIHP community.
There are 3 friends who come to a river, and it's a beautiful day, but that scene is pierced by the cries of people in the water, in the river, crying out for help, in need of rescue. The 3 friends do what all of us do, especially those of us in healthcare. They jump right in to save those people, adults, children, the elderly. At first, the first friend, the strongest swimmer, says, I'm going to focus on those who are about to drown, just at the edge of the waterfall. Everybody applauds that decision. Of course, it makes total sense to rescue those about to drown, and everybody doubles up and says, let's rescue. People along the sides of the riverbank say that let's invest more resources, give that rescuer what he or she needs. But over time, it becomes clear that that's insufficient. People slip through the grasp of the rescuer. Clearly, something else is required. The second friend, actually, along there says, you know what, to make this easier, to make our success rate go up, let's coordinate the branches along the banks of the river here and create a raft so we can usher more people to safety, prevent people from going further downstream in need of rescue. We all applaud that. The success rate goes up, fewer people in need of downstream rescue, more people on the raft getting ushered to the riverbank. And yet, in the course of that work, the first friend and the second friend, the downstream rescuer, the raft builder, realize something is happening that they can't fully articulate, but they see it every day. The people keep coming. The success rate, while better, still isn't as good as they would want. People slip through. They start getting tired. They start getting a little jaded, perhaps. They start saying things like, to the people in the water, why don't you know how to swim? They start considering other rivers to jump out into, leaving maybe the purpose of rescuing. They start getting tired. But like a lot of us, they remain doubly committed to the work, and they remain heroically, nobly committed to rescuing, despite this strange phenomenon. Finally, they realize that they came with a third friend, and they don't see that third friend. They finally spot her. She's in the water. She's rescuing people as she's going, but she's swimming away from them, much further upstream. And they shout to her, where are you going? There are people here to save. They're in dismay. They're wondering why their third friend, a vital part of their team, is now leaving them. Turns out she's not leaving them. She's actually in the water again, helping people as she's going. And she shouts back to them, I'm going to find out who or what is throwing these people in the water. The reason I tell the story that way is because in the American healthcare workforce, and I think in the healthcare workforce in many parts of the country, of the world, we know that we have that first friend. We have that downstream rescuer, the trauma surgeon, the ICU nurse, the intensive case manager, the ER doctors, the oncologists. These are people that are vital, necessary parts of the workforce that we know we need. You want them when you're in dire straits. We're now in the phase of that second friend, the comprehensivist, the raft builder, the person who creates that primary care patient-centered medical home to usher more people to safety, to screen for certain issues, manage chronic diseases, make sure that those who are at risk of disease actually are prevented from becoming sicker. But we know increasingly now that while that's an important phenomenon right now in healthcare transformation in the US, the idea of the downstream rescuer and the raft builder, primary care comprehensivist, while we're in that phase, we know simply by looking at our patients and simply looking at what healthcare looks like on the ground every day, that model of the healthcare workforce is necessary but insufficient. What we have in the healthcare workforce right now, not nearly enough of, but what we do have certainly are that third friend. We have the upstreamist. The upstreamist's job is not to be the hero nurse or hero doctor or hero community health worker who is individually taking on rescuing people, but is instead, as many upstreamists before us have done, thinking about how to systematically understand and address the social determinants of health, where people live, where they work, and bring that understanding into the workforce and the workflows of clinical medicine, of healthcare.
The video discussed what each part of the river can look like in healthcare. Downstream, someone has acquired health issues or has a chronic disease and is looking for health care and or acute services. Midstream. Here, the clinic is trying to prevent or manage chronic disease someone has and promote self-care management. Upstream, the clinic is trying to address the social determinants of health, conditions in which people live, work, and play. At SCIHP, downstream looks like the following. SCIHP provides health care to those in the community who have chronic or acute healthcare issues. The Acorns team focus in this section was to collect data. With the Acorns grant, we were required to perform the PREPARE questionnaire for 2 years. This questionnaire asks questions on the social determinants of health. Questions that ask about the availability of resources to meet health care and daily needs. Questions like, do they have access to transportation, food, and health education? Patient surveys have also provided data on our community about chronic disease as well as home visit assessments performed by the CHRs. Midstream. Here we're trying to modify individuals' health behaviors by providing tools and resources. This outreach approach centers around those that have been diagnosed with a chronic disease and need assistance for self-management. In collaboration with the medical team, the Acorns team creates home BP kits that provide help and education to those with hypertension. We also create tobacco cessation kits and offer them to the patients using commercial tobacco products. It is also an opportunity to start a conversation with those patients that are current smokers to consider reducing their use and considering quitting altogether. Another program we created this year in collaboration with the medical team was the Healthy Hearts program, where we promote the patients to have their labs performed, as well as providing specific education fact sheets and brochures. Upstream. Here we're trying to improve community conditions, which in turn can improve community health outcomes. The Acorns team tries to accomplish this by supporting community health for all people. We do this by sponsoring the Veggie Day community event, where fresh vegetables are provided, health screening is performed, and cultural health education is promoted. and most important, social outreach to the community, an opportunity to see and speak with the community we serve. Upstream actions are like building a fence so people don't fall into the river.
Pictured here is our Acorns home blood pressure kit, which includes electronic home blood pressure monitor, BP education, and tracking card. When the tracking card is brought back, it starts a discussion with their healthcare team. Patients are then given an incentive when they bring back the tracking card with 30 days worth of readings. To this date, we have provided 90 home blood pressure kits. The SCIHP team recognizes that only about 5% of people who try to quit tobacco succeed without a quit smoking product or education on how to quit. Using quit smoking education and nicotine replacement products can greatly increase the chance of success of quitting. And it's even better when you combine counseling with one or more quit smoking products. Our quit kits contain education, stress tools, and items to substitute using cigarettes. Our hopes later this year is to collaborate with the medical and pharmacy teams to describe and educate the community on the nicotine replacement products we provide here at SCIHP, such as nicotine patches and gum. In addition, the Acorns teams completed the tobacco cessation specialist training from Duke University, and we plan to have in-house referrals for our patients in the future. To date, we have provided 84 kits. We continue to use our 2021 campaign in this grant cycle with the message to keep tobacco sacred. T-shirts and posters were provided to the community and staff during the Great American Smokeout. Acorn staff are required to complete a health communication messaging strategy each year. This year, we decided to bring awareness to hypertension and the importance of having your blood pressure performed by the SCIHP healthcare team. We rolled out the campaign in May during World Hypertension Day. You can see their posters located throughout the clinic, and we also have postcards to perform outreach to our patients. This year, in collaboration with the SCIHP medical assistants and the SCIHP phlebotomist, we promoted patients to have their healthy heart labs performed during Heart Month in February, and we extended it to March as well. If patients had all three performed, A1C, lipids, and BP, they received an Acorns gift card. We had 93 patients participate in this program. Another aspect of the Acorns grant is to promote physical activity. We started this Get Active program in February of 2022. It's called 90 Minutes of Wellness. It is open to active patients and staff. We ask that active patients submit their weekly physical activity minutes to acorns@scip.org, and their names are entered into monthly drawings. Total minutes since we started the program are approximately 57,000.
Since December of 2021, we have been providing health screenings to our community. In the past months, during Veggie Day, SCIHP patients have stopped to discuss their health while staying in their cars. We have performed a variety of screenings like taking their blood pressure, performing point-of-care A1Cs, HIV testing, and recently hepatitis C testing. If anyone has elevated test results or have positive test results, we coordinate follow-up care with their providers. We are extremely proud of this effort. Total number of patients screened in our screenings is 120. One of the many deliverables for the 2022 Acorns grant is to create educational videos and have them posted on Facebook and YouTube. We have completed 4 videos, and you can find them on the SCIHP YouTube channel.
Our last project has been our largest community activity. We recognize that it is vital that we continue to meet and speak with our community, and this is accomplished with the Acorns outreach events. By having conversations with our community and using community assessment tools like the Prepare survey that covers social determinants of health, we recognize that food insecurity and access to fresh vegetables was one of the top 3 concerns for the SCIHP community. The collection of data helped to create Veggie Day, an opportunity to provide fresh produce to the SCIHP patients, as well as health education in the Acorns newsletter. We also provide information on what other SCIHP departments are offering to the community, and the opportunity for patients to have healthcare screenings while waiting in their cars. This community event has been a great success because of the assistance from the medical front desk, the facilities department, the medical assistants, Healthy Traditions, the infection control coordinator, and the support we have been given by administration. We also look forward to working with the behavioral health department this coming month. As of December 2021, the Acorns team has provided a total of 1,785 fresh vegetable and chronic disease education kits to the SCIHP community.
Thank you, SCIHP family, for working with us and supporting the Acorns grant. We look forward in continuing our community health programs in 2022.